She is Dr. Malai Kwan in the game Microbiology and Disease Transmission Management. She is now practicing dentistry in a rural place where there are fewer people, most of whom have oral cavity-related diseases. Her goal is to treat those people in need. But before doing so, she needs to accomplish 3 missions. First, roles of microorganisms in disease transmission. Next, common pathogens in dental setting. Lastly, routes of transmission and infection control measures. First mission. She learned that microorganisms, also known as microbes, are ubiquitous and can be found in various environments, including the human body. For instance, bacteria, viruses, fungi, and parasites are microorganisms that play a significant role in the transmission of infectious diseases because they can be transmitted through various routes. Hence, understanding the mode of transmission of these microorganisms can help in implementing appropriate infection control, especially in the dental clinic where close contact with the patient's oral cavities is common. But before Dr. Malai Kwan delves more into the mode of transmission of these microorganisms, she needs to know what are the different microbes. Bacteria are single-celled organisms that can exist in various shapes and sizes. While many bacteria are harmless or even beneficial, some bacteria can cause diseases. Examples of bacteria associated with oral infections include Streptococcus mutans, which is a major contributor to oral dental caries. Bacteria can be spread through direct contact, contaminated surfaces, or droplets produced by coughing or sneezing. Next are viruses. They are infectious agents that can only replicate inside host cells. They are responsible for a wide range of diseases, including hepatitis and human immunodeficiency virus infection. They can be transmitted through direct contact with infected bodily fluids or contaminated surfaces, as well as airborne droplets. Another microorganism is fungi. It is a diverse group of organisms, including yeast and molds. While most of them are harmless, some can cause infections in humans. For instance, oral candidiasis, also known as thrush, is a common fungal infection in the mouth. Fungi can be transmitted through direct contact or inhalation of fungal spores. Lastly, are parasites. They are organisms that live on or within another organism and rely on it for survival. In dentistry, oral infestations with lice or mites are a common example of parasitic infection in the mouth. Parasites can be transmitted through direct contact or vectors, such as insects. Pathogens. It is a microorganism that has a net negative effect on the host. These are microorganisms that are capable of causing an adverse reaction within their host. Classification. There are a plethora of ways to classify these microorganisms, but the usual basic classifications are bacteria, viruses, fungi, and parasites. Disease, transmission. Pathogens may be transmitted through various channels, such as contact with body fluids, inhalation of airborne pathogens, ingestion of contaminated food, and etc. This is the channel that the pathogens use to find their host. There are also unique ways that pathogens infect an organism, like using a vector to infect a host, or even simply waiting for the host to become vulnerable. Virulence factors. Enzymes, toxins, adhesion molecules, and evasion mechanisms are used by pathogens to help infect the host, which dictates the type and severity of said infection. Host-pathogen interaction is a reactionary relationship between the host and pathogen, where the ability of the host to recognize and combat an infection is pooled against the ability of the pathogen to shield itself from the detection and the attacks of the host's immune system. Opportunistic pathogens. Microorganisms that are normally harmless but become pathogenic once the immune system is compromised. They usually come from the natural microbiota of the host. These microbes also often are beneficial if kept in check and managed well. Antibiotic resistance is the acquired resistance of microbes against antibiotics due to improper use or overuse. Second mission. Since Dr. Kwan is a dentist, of course she needs to learn the common pathogens in dentistry. First, Streptococcus mutans. It is considered the primary pathogens responsible for the dental caries in the oral cavity. It can be transmitted either directly acquired from contact to contaminated objects or vertical happens during infancy. To prevent the accumulation of Streptococcus mutants, It is important to limit the consumption of sugary foods and practice proper oral hygiene, like using a toothbrush with adequate fluoride, along with regular dental visits to support oral health education. Second, Porphyromonas gingivalis. In the intricate world of oral health, Porphyromonas gingivalis emerges as a leading antagonist, causing inflammation and tissue destruction, ultimately leading to tooth loss. Identified in 85.75% of chronic periodontitis cases, this purple-hued bacterium persistently colonizes the oral biofilm as a secondary plaque colonizer. Transmission occurs through direct contact with infected fluids and respiratory droplets. To combat its threat, preventive measures take the spotlight, advocating for good oral hygiene, professional dental care, and addressing systemic conditions like diabetes. This ongoing saga portrays a resilient battle against Porphyromonas gingivalis, where preventive strategies stand as the guardians of oral well-being. Herpes simplex virus, or HSV. A double-stranded DNA virus with two classifications, which are HSV1 and HSV2, but HSV1 is primarily encountered in dentistry that has clinical manifestations of gingivostomatitis. To prevent such existent standard precautions should be practiced, such as avoiding severe dental cases in a clinic, along with prior knowledge with the effects of pathogens and how it will be treated with antiviral and post-exposure prophylaxis. Human immunodeficiency virus, or HIV. HIV is the virus that causes acquired immunodeficiency syndrome, or AIDS. Although HIV does not directly cause oral infections, it can still lead to oral manifestations and opportunistic infections in individuals with advanced HIV disease. These oral conditions are often an indication of the progression of the disease and the decline in immune function. In terms of transmission, HIV is primarily transmitted through contact with certain body fluids, including blood, semen, vaginal secretions, and breast milk. However, in a dental setting, the transmission can occur through exposure to blood or other potentially infectious materials, such as saliva contaminated with blood. The oral manifestations of HIV may include oral candidiasis, thrush, oral ulcerations, periodontal disease, and Kaposi's sarcoma, and they can cause great discomfort and pain and can affect the overall oral health and quality of an individual with HIV. The preventive measures and strategies for HIV infection include strict adherence to standard precautions, including hand hygiene, use of personal protective equipment, and proper disinfection and sterilization protocols. Second, screening of patients and knowing their medical history. Applying universal precautions also help to ensure that all patients are treated as potentially infectious, regardless of their known HIV status. Next, implementation of safe injection practices, proper handling and disposal of sharps, and using of safety-engineered devices to reduce the risk of needle stick injuries. Another preventive measure is post-exposure prophylaxis. And lastly, patient education and counseling to patients about HIV transmission, prevention, and the importance of disclosing their HIV status. Methicillin-resistant Staphylococcus aureus, or MRSA. Methicillin-resistant Staphylococcus aureus is a strain of Staphylococcus aureus that has developed resistance to multiple antibiotics. Dental healthcare personnel should follow standard precautions and maintain good hand hygiene to prevent transmission of MRSA. MRSA can lead to oral abscesses, cellulitis, and other types of oral and orofacial infections. It is typically transmitted through direct contact with infected individuals' oral secretions, contaminated instruments, oral inadequate infection control practices. The infection can manifest as localized skin and soft tissue infection, such as abscesses, boils, or cellulitis, swollen lymph nodes, and persistent mouth ulcers. Preventing the transmission of MRSA in the dental clinic is crucial to minimize the risk of infection for patients and dental healthcare personnel. Here are some preventive measures and strategies. Adherence to standard precautions, including proper hand hygiene, use of PPE, and proper disinfection and sterilization protocols. Patient screening to help identify individuals who may require additional precautions. Implementing enhanced cleaning and disinfection of dental instruments, equipment, and surfaces. Lastly, implementation of transmission-based precautions, such as contact precautions. Hepatitis B virus, or HBV. A blood-borne pathogen that can cause a serious liver infection. While HBV primarily affect the liver, it can also have oral manifestations and affect oral health. Transmission can occur if proper infection control measures are not followed, particularly through exposure to blood or contaminated instruments. Some preventive measures and strategies for HPV are: first, vaccination against HPV. Second, strict adherence to the standard precautions, such as proper hand hygiene, using of PPE, and following proper disinfection and sterilization procedures. Third, patient screening to help identify those who may be carriers or have active infection. Fourth, applying universal precautions and practice safe injection procedure, including the use of sterile single-use needles and syringes. Lastly, our post-exposure management and providing education to patients about HPV transmission prevention and the importance in disclosing their HPV status. Third mission, direct contact transmission. In the dental setting, direct contact transmission can occur through activities such as handshaking, touching contaminated surfaces, or contact with infected bodily fluids. To prevent direct contact transmission, proper hand hygiene is needed as dental healthcare professional, such as washing hands thoroughly with soap and alcohol. Personal protective equipment, such as gloves, protective eyewear, and appropriate use and disposal is needed. Regular cleaning and disinfectants should be used in the dental clinic is essential to reduce the risk of direct contact transmission. Indirect transmission, a type of transmission acquired from having contact to contaminated equipment in a dental setting. Factors to consider in hindering the pathogen existence are sterilization, which steaming in an autoclave is recommended, using barriers for equipment such as wrapping it with plastics or bags, and disinfecting the working area to get rid of microbes. Airborne transmission. It occurs when microorganisms are suspended in the air and inhaled by individuals. To prevent airborne transmission in a dental setting, certain procedures can be done. First, use of high efficiency. Particulate air filters, which are installed in the dental clinic's ventilation system to remove airborne particles and reduce the risk of airborne transmission. Second, aerosol management, like the use of high-volume evacuation and dental dams during dental procedures that generate aerosols, such as drilling or scaling. HVE suction should be positioned near the source of aerosol generation. Third, proper ventilation in a dental clinic is also important in a dental clinic to maintain good air circulation and reduce the concentration of airborne microorganisms. Droplet transmission is a transmission of pathogens due to inhalation of an infected organism's naturally produced body fluids. Bacteria or viruses spread through large respiratory droplets that people sneeze, cough, or exhale. Currently, the term droplet is often taken to refer to droplets 5 microns in diameter that fall rapidly to the ground under gravity and therefore are transmitted only over a limited distance of about 1 meter. The transmission is completed by inhaling droplets or droplets entering the mucous membranes of the face. Vector-borne transmission. Vector-borne diseases are human illnesses caused by parasites, viruses, and bacteria that are transmitted by vectors. Vectors are blood-sucking insects that ingest disease-producing microorganisms from infected hosts during a blood meal and transmit them to a new host after the pathogen has replaced. Often, once a vector becomes infectious, they are capable of transmitting the pathogen for the rest of their life during each subsequent bite-blood meal. Host-pathogen interaction. This refers to the dynamic relationship between a microorganism, pathogen, and the host organism, in which the microorganism tries to establish an infection, and the host's immune system responds to prevent or control the infection. Pathogens enter the host's body through inhalation, ingestion, or contact with mucous membranes or breaks in the skin. The immune system recognizes antigens, which trigger the production of immune cells and molecules to eliminate the pathogen. The immunity response can be divided into 2 main types: innate immunity and adaptive immunity. Innate immunity is the first line of defense, while adaptive immunity is a specific and tailored response that develops over time. Pathogens may produce virulence factors that interfere with the host's immune response, such as toxins that damage immune cells or molecules that inhibit immune cell function. The outcome of the host-pathogen interaction can vary. In some cases, the host's immune response successfully eliminates the pathogen or recover from infection. In other cases, it may lead to the development of clinical disease. Chain of infection. Understanding the chain of infection is crucial for interrupting disease transmission. The chain of infection consists of 6 components: Infectious agent, microorganism, reservoir, source of the microorganism, portal of exit, how the microorganism leaves the reservoir, mode of transmission, how the microorganism is transmitted, portal of entry, how the microorganism enters the host, and susceptible host. Breaking any link in the chain of infection can prevent disease transmission. Congratulations! You've accomplished your 3 missions! You can now proceed to the next level! Welcome to the breaking of the chain infection! Hand hygiene. Hand hygiene includes proper washing of hands before and after clinic. It can also be achieved through hand sanitizing. Proper sterilization. To kill the microorganisms, proper sterilization of dental instruments is a must. It can be done through steam and autoclave. Use of personal protective equipment. Wearing of PPE is essential not just for medical doctors, but for dentists as well. PPE includes gloves, face masks, protective eyewear, face shields, and protective clothing. Respiratory hygiene. Respiratory hygiene can be done by covering the mouth and nose when coughing or sneezing, using of tissues and throwing them away after. Waste management and disposal. For waste management and disposal, all hazardous waste accumulated in dental clinics must be stored in closed and properly labeled containers. Congratulations! You've learned everything about microbiology and disease management. You can now practice dentistry. Dr. Melikwan is now practicing dentistry in the clinic, carrying her learnings all throughout the missions she had accomplished successfully. Her goal of treating the people in need in the said rural place has been achieved. Dr. Melikwan's patients thanked her as she had made an impact on their lives. Victory! You've successfully finished the